Hi everyone, welcome back to my channel. I'm Dr. Jodhpal Singh, and today I wanted to talk about physiology and how your physiology changes over time, particularly due to aging. This will cover your heart function, and over the next few lectures, we'll go through your lung function, your gastrointestinal tract as well, and we'll just highlight how the older you get, the kinds of stress that you go through in your life, how all these different things can affect your overall physiological function. Okay, so why is studying aging important? Well, physiology, of course, as we know, changes and varies significantly. For example, this happens across your entire lifespan and your entire life cycle. When you're children, there's differences in pediatric physiology almost on a month-to-month basis. And of course, because you're growing. Okay, so as far as heart function goes, your heart, of course, is affected as you age. Our heart beats roughly 100,000 times per day. Of course, depending on, your heart rate and depending on what kind of exercises you're doing, if you're exercising as well, and any other factors that can cause your heart rate to increase or decrease. But in rough approximation, we would expect about 100,000 beats in a day. And, that equates to roughly 36 million beats every single year. And from there, we can expect for an average lifetime, your heart is going to beat 2.5 billion times. So if you consider each contraction, 2.5 billion contractions is a ton, right? So your heart over time has to contract so often, it undergoes so much stress, and it's got such an important function to supply your body with so much blood and oxygen that it really does become important to understand how the heart is affected under stress. And when you think about it, the blood, it goes through your right atrium here into your right ventricle, and then after your right ventricle, it goes into your lungs. From there, you breathe in oxygen, and the blood that's picked up the oxygen comes back up through the left atrium into the left ventricle, and then it can get pushed into the rest of the body. Not all the blood that goes into the left ventricle gets pushed out based on, the force of contraction, and based on your heart rate, you have a certain amount of blood coming out with every heartbeat. So that's called the stroke volume. And as a ratio of the amount of blood that's in the ventricle that's being pumped out, that would be called your ejection fraction. So from all the blood that's in the ventricle, we expect roughly 50 to 70% of that to be coming out. 70% would be quite high. But as you age, actually, this ejection fraction, so the amount of blood that comes out of your ventricle, increases with time. The reason this might be occurring is because there's a reduction in something called end systolic and end diastolic volume. So there's a good chance that, your body just had less total blood volume, including how much is available in the ventricle after systole and diastole. So because of that, your amount of blood that comes out from every heartbeat has to be a little bit higher as a relative total, just because you're still trying to get enough oxygen and blood to the other organs and other tissues in your body as well. Okay, so of course your heart function is dictated by a lot of changes in pressure gradients and changes in blood volume as well that allow valves to open and close. But a lot of this initial response is due to a electrical stimulation. Now, there's, of course, in the very top right side of your heart, a pacemaker, and that's called your sinoatrial node or your SA node. And this allows for the initial electrical signal to initiate, and from there it travels through your atrium into your ventricles and allows for a big contraction to occur. The electrical stimulation is what causes or signals that ventricular contraction and provides that, energy in order for that to occur. And you probably see it all the time in medical shows, this kind of waveform here. You have your P wave, which represents your atrial systole, and then a giant QRS complex, and that's your ventricle actually contracting. And then, of course, the T wave as well. And the T wave is the relaxation period, and then the refilling period as well. So, your ECG signal, of course, is an indication of electrical activity, of cardiac activity, and it's required in order to produce a heartbeat as well. So the whole idea with electrical conduction is, as you age, the inflammatory responses that have occurred over time, and potential fibrotic as well, right? Through fibroblast activity from immune responses, any kind of stiffness or any kind of scar tissue that's developed too. All this stuff put together can really damage your sinoatrial node and your AV node as well from there. And because of that, your sodium, potassium, calcium channels can all be disrupted as well, and that can lead to problems with electrical conduction over time. And this includes, the development of arrhythmias and weakened ventricular contractions as well. Okay, so one big thing that we have to talk about is cardiac remodeling. When we talk about the brain, for example, a lot of people now understand this idea of neuroplasticity. So the whole idea that based on different mechanisms and pathways, your brain can actually develop new patterns and new connections, even as you age. And damaged areas of the brain, for example, maybe after a stroke, a lot of these different areas can be rehabilitated, and new networks, and again, those kinds of things can form following interventions such as exercise, maybe some supplement input, or some medications as well. But with the heart, it's a very similar approach where we have cardiac remodeling, meaning your heart, based on the types of stress that's placed on it, actually changes its structure, its function, even its size. For example, if you're a marathon runner, your heart is going to function accordingly to the kind of stress that a marathon would place on your heart. For example, you get more eccentric hypertrophy, so your heart looks almost more like an oval or a little bit longer in shape in comparison to someone who's a power lifter who would get concentric hypertrophy, so their heart would be a lot more spherical in shape. So depending on, again, the type of stress that's placed on your heart, its overall function and purpose will adapt accordingly. Now, one problem, especially when it comes to aging with remodeling, is following some kind of injury. If, again, we consider as you age, you've got a dysregulated immune system, you've got so much other wear and tear and inflammatory responses throughout your body that's very different than someone who's a lot younger. We mentioned before some of your sinoatrial nodes or AV nodes may already be problematic as well. Your ventricles and atrium might already be stiff, potentially, depending on the lifestyle and habits you've had. And of course, your blood volume might be reduced as well. So all these things become really important when we talk about cardiac remodeling, especially in the context of recovering from some kind of injury. Now, if we consider something like an ischemic injury, so let's consider a heart attack. If you have an infarction, and if you're, for example, 25, what happens is you get an immediate immune response to occur with the treatment, or your body's internal treatment of the infarction, and roughly within 3 to 5 days you get clearance of some of these dead cells, and this occurs through your white blood cells, your red blood cells, your fibroblast activity as well. And your fibroblasts also deposit quite a bit of collagen into the area where the infarction occurred. And this can lead to scarring, at the area of the ischemic event. And this scar, when you're younger, tends to be quite stable. You tend to, recover as normally as anybody else would, and you tend to just kind of keep going, assuming, all the other treatment aspects are considered and kept proper. The interesting part is when you're older, because, again, your immune response is not going to be as immediate, you have higher level of inflammation and pathological hypertrophy as well at the baseline level before your heart attack. your heart is already at a very poor state in comparison to the younger individual. And when you add the stress of something like an ischemic event or an infarction, you get a slower immune response, you get less collagen formation, and you end up getting this weak scar on your ventricle, and your ventricle is actually quite altered, from that point onwards. And again, you're at a much higher risk of some other type of adverse cardiac event occurring as compared to somebody who's quite a bit younger. Depending on the type of treatments that you intake now, and thanks to the advancement of medical science as well, there is a good chance that you will recover from something like a heart attack and have, generally speaking, a relatively normal life as compared to anybody else. But internally, of course, being younger does have a much more immediate response as compared to being older.